Understanding coronary calcium scans, a simple heart test that could save your life. Coronary calcium scan, a life-saving heart test you shouldn't overlook. When we envision a cardiac arrest, our minds often conjure up intense images. Sharp chest pain, the blaring sirens of ambulances, and the frantic pace of emergency surgeries. Yet, the reality is that for many individuals, heart disease is silently developing long before any noticeable symptoms arise. This is precisely where the Coronary Artery Calcium, CAC scan, becomes invaluable. This test is not only quick and non-invasive, but it is also surprisingly underutilized, especially given the critical, life-saving insights it can offer. Dr. Dinesh Narang, a senior interventional cardiologist at Lilavati Hospital, emphasizes the importance of this test. While traditional blood tests and stress tests have their merits, they do not reveal the presence of heart disease. In contrast, CAC scanning does. It is one of the few methods available that can detect heart attack risks that would otherwise remain hidden. The CAC scan is a specialized CT scan designed to identify calcium deposits in the arteries that supply blood to the heart. These deposits serve as early indicators of plaque accumulation, a condition known as atherosclerosis, which can ultimately lead to a cardiac event. The results of the test yield a calcium score, which provides significant insights into your heart health and whether you should take precautionary measures. A score of 0 indicates zero plaque, meaning you have no visible heart disease and are in the clear. A score ranging from 1 to 100 signifies mild plaque, indicating some plaque buildup, but typically manageable through lifestyle adjustments. A score between 101 and 400 is classified as moderate plaque, suggesting that it's time to take proactive steps, possibly including medications like statins. A score of 401 or higher is categorized as extensive plaque, indicating a high risk where immediate intervention is essential. Dr. Aakruti Mehta, a preventive cardiologist and educator, asserts, a CAC score of 0 is the most potent negative predictor we have in cardiology. It's akin to receiving a clean bill of health for your arteries. Conversely, a score above 401 is a clear signal that your heart is in jeopardy. However, it's crucial to note that the CAC scan is not suitable for everyone. It is intended for individuals who find themselves in a grey area, not classified as low risk, yet not high risk either. But here's where it gets controversial. Should everyone consider getting a CAC scan, or is it only for those with certain risk factors? This question often sparks debate among healthcare professionals. What are your thoughts? Do you believe that more people should be screened, or do you think it should be reserved for those with existing risk factors? Share your opinions in the comments. Early detection of heart attack risk. Simple blood tests could save lives. Imagine waking up tomorrow, knowing that a single vial of blood could have told you, 5, 10, even 15 years earlier, that your heart was quietly plotting a surprise attack. That's not science fiction. It's the new frontier of preventive cardiology, and it's already sitting in your neighborhood diagnostic lab. But here's where it gets controversial. Most doctors still won't order these tests unless you beg, and many insurance plans label them experimental. Should a test that might save your life really be optional? The quiet killers hiding in your bloodstream. India's #1 cause of untimely death isn't cancer, road accidents, or infections. It's the sudden cardiac event that shows up uninvited and unannounced. Traditional red flags like chest pain or sky-high cholesterol often miss the real culprits. Enter predictive biomarkers, microscopic messengers that start shouting long before the heart throws in the towel. High-sensitivity C-reactive protein, HSCRP. Think of HSCRP as the body's fire alarm for low-grade chronic inflammation. When arteries simmer at a slow burn, HSCRP levels inch upward. A value above 3 milligrams per litre doesn't guarantee a heart attack, but it whispers, your pipes are overheating, Check the wiring before the blaze starts. 2. Lipoprotein A, or LPA. This is cholesterol with a genetic grudge. Unlike LDL, which you can often tame with diet and statins, LPA is almost entirely inherited. South Asians in particular carry some of the world's highest LPA burdens. A simple genetic lipoprotein panel can reveal whether you've been dealt this hereditary wildcard. 3. High sensitivity troponin. Emergency rooms use troponin to confirm a heart attack in progress. New ultra-sensitive assays, however, can pick up minute leaks of this heart muscle protein years in advance. Picture it as a hairline crack in a dam wall, too small to see with the naked eye, but a laser sensor spots it early enough to reinforce the structure. The game changer? No fasting, no treadmills, no tubes down your wrist. Unlike the old stress test marathon or the invasive angiogram, these biomarker screens need only a routine blood draw. No 8-hour fast, no running on a treadmill until your legs give out. You could literally schedule it during your lunch break. AI turns raw numbers into a crystal ball. Once the lab spits out your numbers, artificial intelligence steps in. By cross-referencing your biomarkers with family history, blood pressure trends, waist circumference, and even sleep tracking data, AI models can now estimate your 10-year or lifetime risk with uncanny precision. Instead of a generic eat less fat lecture, you get a personalized playbook. Maybe a low-dose anti-inflammatory, a targeted PCSK9 inhibitor for stubborn LPA, or simply a Mediterranean diet plus 7,000 steps a day. Young India, take note. The average age of a first heart attack in India has slipped below 50. Blame desk jobs, binge watching, and the irresistible combo of samosas plus stress. Yet most 20 and 30-somethings still believe annual checkups are for their parents. Adding HSCRP, LPA, and high-sensitivity troponin to a basic lipid profile could flip that script. But, and this is the part most people miss, knowing your numbers is only half the battle. The other half is acting on them. Will you swap late-night biryani for grilled fish? Will you push your HR department to fund standing desks? Or will you shrug and say, I feel fine, so I'm probably safe? A moral dilemma wrapped in a syringe. Some ethicists argue that widespread biomarker screening could trigger anxiety or over-medication. Others counter that the cost of ignorance, emergency stents, lost wages, orphan children, is far steeper. Where do you stand? Should these tests become as routine as a hemoglobin check? Or should they stay locked behind specialist gates? Your move, before the silent damage becomes irreversible. Heart attacks don't erupt overnight. They're slow-motion disasters that compound across decades. A basic blood test ordered today could hand you the cheat codes to rewrite that timeline. The science is ready. The labs are ready. The only question left is, are you? So tell us, would you demand these biomarkers at your next checkup? Or do you think we're over-medicalizing normal life? Drop your thoughts below. Let's spark a conversation that might just save a heart. Maybe even your own.